Measles is the most common in children under the age of 5. Symptoms include fever, cough, runny nose, and a distinctive rash. Dr. Amesh Adalja joins us now. He's a senior scholar at the Johns Hopkins Center for Health Security. All right, doctor, how did we get here, and what has led to the comeback of measles in the United States?
So even though measles was eliminated from the Americas, North and South America, it continued to circulate in places like Africa, Asia, and even Europe. And because it's such a contagious disease, the only thing that was keeping it at bay was high levels of vaccination in the United States. And when I say high, I mean like 95%, very, very high because of the contagiousness of this virus. So what's happened is post-COVID, there's been a lot of vaccine hesitancy and a lot more exemptions that people are filling out for their schools. And that's kind of kindling for measles. And what ends up happening is an infected traveler gets off a plane, they've been to somewhere where there's measles, and then they spread it to unvaccinated individuals. And this isn't anything new. We had big outbreaks in 2014 and 2019, but I think people are very worried because of the the anti-vaccine movement's strength right now, that this could be kind of a whole turning point with our ability to control measles.
We don't really talk about measles all that often, but how serious of a disease is it if it's contracted, and are adults at risk as well?
So measles is something that used to kill about 1,000 children in the pre-vaccine era in the United States. Most children do have a mild illness, but it can cause pneumonia, it can cause brain infection, it can cause hospitalization. And the thing is, why would you even want to risk that, even if those are rare complications, when there's a safe and effective vaccine? Worldwide, measles still kills over 100,000 children. So it isn't a benign illness. It's not something that people hear their grandparents talk about and think of it was sort of like an idyllic childhood disease. It's something you want to avoid. And I think that's the problem, is that people think of it as some benign illness, and it really has all of these severe consequences. It actually even erases part of your immune system. It causes immune amnesia, so you don't respond well to other infections after you've had measles. So this is something that we really have to combat in people's minds, because they haven't had the ability to actually see what measles can actually do.
Doctor, you mentioned COVID. How have COVID vaccination fears impacted vaccination rates as a whole for measles?
What we find is that the anti-vaccine movement used the animosity towards the COVID vaccines to really kind of cause it to metastasize to all the other vaccines. So not only are we seeing lower rates of measles vaccines, but lower rates of tetanus vaccines, lower rates of flu vaccines. We've also even seen lower veterinary vaccines. And I think this is what we worried about, is that the anti-vaccine movement will capitalize on anything that they can in order to sow distrust over one of what I think is humankind's greatest inventions. And back to your other question, you said adults. Usually adults don't have major risks from measles because they've been vaccinated. They were vaccinated during an era when anti-vaccine sentiment was low. And if they're very old, they likely were exposed naturally when the virus circulated in the United States in the up until the late 1950s. But there are some adults that are not vaccinated or that are immunocompromised that could be at risk for severe disease from measles.
And doctor, as we wrap things up, what precautions should people be taking now?
Well, I think the first thing is to make sure that you are up to date with your measles vaccine, especially your children. If you have children, that they're up to date. Talk to the pediatrician, make sure that they didn't slip off the schedule because of the disruptions of COVID. And I think if you're somebody that was vaccinated routinely during childhood, you don't really have much to worry, but it's really important that we advocate for this vaccine, and those individuals who are either unable to be vaccinated because they're immunocompromised, or maybe they're too young. We start vaccination around 12 months of age, that we advocate that other people around them kind of give them a bubble so that they are protected from this very contagious disease.
All right, Dr. Amesh Adalja, thanks so much for your expertise today. We appreciate it. All right, still to come on